coming up on Asian Focus, the truth behind postpartum depression and how that's different from the postpartum blues that affect most new moms. And later, the pianist Yao Fei Chuang plays Ravel. I'm Mary Sitt. All this coming up on Asian Focus. To babies when their mothers suffer from sadness, fatigue, change in sleeping and eating patterns, crying, jags, and anxiety. The birth of a child is supposed to be a joyful time, but for some mothers, it's not. These are moms who suffer from a form of clinical depression called postpartum depression, and it's far more serious than the usual baby blues most new mothers go through in the first few weeks after the birth of a baby. Here to tell us more is Dr. Cindy Liu, an assistant research professor at University of Massachusetts, Boston, and instructor of psychology at Harvard Medical School. She's a recipient of numerous honors and awards. Thanks so much for being with us, Dr. Liu.
Thank you, Mary.
Okay, so tell me, what is this postpartum depression that you're researching?
So postpartum depression, as you mentioned, is a form of clinical depression that occurs after childbirth. Usually the onset peaks around 3 weeks after one gives birth and affects mothers. Sometimes it affects fathers, but mostly mothers. And it's a period in which mothers might endorse feeling depressed or having lost interest in things that they're normally interested in, changes in appetite and sleep,
Isn't that
fatigue.
usually because of the demands of a baby?
Exactly.
You know, they want to eat all the time, poop, sleep, and you're constantly taking care of this little person who demands all of your energy, all of your time, and plus you're just tired all the time. I mean, could that be the cause of the depression, or is this beyond that?
It's beyond that. So that's the funny thing about postpartum depression. It's a little tricky to distinguish that from kind of the regular occurrences that people might experience after giving birth, all the changes.
Remember a couple of years ago when Tom Cruise got in a fight with Matt Lauer, the host of the Today Show, about postpartum depression, and I forgot what new celebrity mother he was talking
Brooke
about.
Shields.
Okay, Brooke Shields, that's right. And he was sort of poo-pooing the whole idea and sort of like, well, can't you just snap out of it? I mean, right? Something like that. I mean, is that the kind of reaction most people have when they hear about a new mom, or is this something that's really being taken seriously and people go, you know, this is a real problem?
Yeah, it's becoming something that people are taking seriously, and I think with our research, we're really trying to kind of present the truth and the reality of experience that these women have. And so what we know is that depending on the research measures used, approximately 5 to 25% of women have experienced postpartum depression.
That sounds like a lot, 25%, 1 out of 4 moms.
Up to 25%. And again, it may not necessarily be a diagnosis of postpartum depression. It may be them kind of reporting that they're experiencing depressed mood sort of beyond feeling that fatigue that you experience after giving birth. And so you had mentioned postpartum blues. And so it's really beyond that. It's something that doesn't necessarily go away within a couple of weeks.
So it could last for months or years?
Yeah, exactly.
And so if that happens, what does that do to the baby to have a depressed mom like that?
So there's a couple of things that can happen aside from just the mom feeling sad all the time and you know, kind of out of it. It can affect her caretaking of the baby. It can affect the health of the baby. Caretaking, you know, might be harder to get the baby to the clinic or to see the doctor. So some of the practical issues are affected, but one of the things that we're also interested in is how does it affect the infant's social emotional development? Because the infant, when they're new beings and they come into this world, and the first person that they meet is their mother or their father, and that's where they learn how to engage with people. And if that's a problem, then it affects them later in development.
So the baby could be looking at mom, making eye contact, and the mom could be gazing off somewhere else instead of engaging with the baby. So the baby could grow up. I mean, do babies reflect moods of their mothers, like the mother's happy, baby's happy, or not necessarily? You know how dogs, or what, you know, they just like, if you're scared, they get, does that happen with infants too?
So I think you're on the right track. Basically, it's that they're picking up what it's like to engage with people. And so if a depressed mom isn't able to engage with people appropriately, the infant's going to pick that up and not know how to actually go about doing that. So for instance, moms who are depressed and withdrawn, when we see them engaging with their babies, their infants tend to kind of protest and be a bit more fussy and show a lot of what we call negative affect.
Really?
Yeah.
Even when she's trying to engage with the baby and trying to be like, you know, happy and cool and all that stuff?
Yeah, well, for what we see is that moms who are depressed, they tend to be more intrusive, so they may not look the same as moms who aren't depressed when they're engaging with their infants.
What do they look? Are they just sad looking or what?
Withdrawn or intrusive. Like what I mean is they kind of get in their baby's face and they really try to get the...
Because they're trying too hard.
Exactly. And so you see the infant responding to that in ways that infants who don't have depressed moms, they just respond differently.
Okay, Dr. Lee, have you done research yet on what happens long term for babies like this? If they have this in the beginning of their life, what happens? I mean, are they permanently scarred, or they sort of grow out of it, or what?
So I haven't conducted any longitudinal studies to look at that. However, from the literature, we do know that they show more behavioral difficulties, some psychological problems, some cognitive difficulties later in life.
You mean like when they're going to school then, relating to teachers and other adults in their lives?
Exactly, because at the beginning, during infancy, they never really learned how to actually engage with people appropriately.
Now, are there predictors, factors that you can tell that this woman is going to have this problem later on?
So one of the biggest predictors of postpartum depression is a previous history of psychiatric problems. So if you've had depression before, you know, you're more likely to have postpartum depression.
Because pregnancy sort of aggravates it or exacerbates it, or what?
So part of it is biological, so an issue with hormones. But what we understand is that there's a pretty strong influence based on kind of the psychosocial experiences that you have. So for instance, during pregnancy, women who don't have a lot of social support, they tend to be more depressed during the postpartum period.
And then also, I read somewhere in your, what you sent, the information you sent me, people who have rocky marriages or just tense relationships with their spouses tend to have, shows up in postpartum depression,
exactly.
Is that right?
So that's sort of like the low social support, low partner support. That is a big predictor of how you feel during the postpartum period.
Okay, we're going to take a little break right now, but when we come back, we'll have more with Dr. Cindy Liu. She's going to tell us why Asian American women seem to have more of this than European American women. Stay with us. We've been talking to Dr. Cindy Liu, an assistant research professor at UMass Boston and a psychology instructor at Harvard Medical School. We've been talking about postpartum depression and how real the problem is and how frequently it is. And it really affects Asian American women a little bit more than European American women. Can you tell me about that?
Yeah, so in a study that I've been conducting, I've looked at New York City mothers, and I compared Asian, white American, Hispanic, and African Americans. And what I found was that Asian Americans showed a higher likelihood of being diagnosed with postpartum depression. Specifically, they were 3.2 times more likely than white Americans to receive this diagnosis.
And is there any indication why?
From my data set, no. However, if you look at some of the other research, you begin to perhaps put together a picture of why that might be. We know that previous psychiatric history predicts postpartum depression, and there was a finding a couple of years ago suggesting that Asian American women between the ages of 15 to 24 had a higher rate of depression and suicidality. So putting that together, we might expect that that particular group may be at higher risk for postpartum depression.
Dr. Lee, how much does our culture have to do with affecting how depressed or not depressed we get and those kind of social pressures from our culture? I mean, in other words, is the Asian culture and the expectations that so many Asian parents have of their kids and daughters, would that have anything to do with the greater depression?
Some people have used that as an explanation. The fact that a lot of Asian families tend to place academic expectations on young women or just gender expectations, you know, fulfilling gender norms. And so if you think about that interpretation, it can make sense.
Okay, so what's next in this research? Do you have, like, is it going to be ongoing, like over a long period of years, and what's your goal for this?
Yeah, so this study looked at New York City women, and it was a survey study that was actually administered by the CDC and the City of New York City. And what I've been working on more recently is looking at Massachusetts women to see if this is something that's true as well. And we're seeing similar things. Asian American women in Massachusetts tend to endorse something that we call anhedonia, which is loss of interest. And they tend to endorse that more often than the other ethnic groups that are being studied.
Now, what can mothers do about it if they do have this postpartum depression?
So the first thing to do is to share this with their healthcare provider. That's probably the #1 thing to do. And I know that oftentimes there's a stigma surrounding sharing something like depression, especially for Asians.
You just don't want to talk about it.
Pardon me?
You just don't want to talk about it.
Yeah, you just don't want to talk about it, especially since the postpartum period is supposed to be a happy time for a lot of women. And so, but my recommendation is to share that with your healthcare provider, because the worst thing is not feeling good during this period of time when you want to feel good and to have energy and to be able to engage with your infant.
Now, in the Chinese tradition, there's a culture of taking care of the mom and the baby for that first month. Can you tell me about that? What is it called?
It's called doing the month. And it's a period of time in which moms basically rest for a month. They stay indoors, and they allow family members to take care of them.
And the baby stays indoors too. Baby can't go anywhere for the first month.
No, baby can't go anywhere for the first month. That's right. So there's a lot of things involved. For instance, taking certain types of herbal supplements, or having herbal types of meals.
And these special soups that don't smell that great, but really good for you, right?
It's supposed to be really good for you. Exactly, exactly. And so.
And the mother and the mother-in-law they both come in and just sort of basically pamper mom and the baby. Is that right?
Really taking care of them during this period of time. Yeah.
So you're going to become your own test subject in a couple of months. Congratulations on your new baby about to be born.
Thank you so much.
A little boy, right?
Yes. Yeah.
Okay. And I hope your husband's prepared to pamper you.
I hope so too.
Dr. Cindy Lee, thank you so much for being with us, and good luck with your research.
Thank you so much.
Coming up next, a special musical treat. The pianist Yao Fei Chuang plays Ravel for us. You won't want to miss this.